At the outset, I'd like to express my sincere gratitude to Dr. Gupta and the International Patients Union for inviting me to speak here and for giving voice to the missing patient's voice. At the outset, again, I'd like to tell you why I'm speaking here today. I'm somebody who has survived numerous episodes of major depressive disorder, which is commonly known as depression. I live with anxiety disorder, and I have also recently been diagnosed with ADHD. I should have been diagnosed when I was a child, but when I was a child, no one even knew what is ADHD. So I'll be talking about that area of health where not many people talk and many people do not express their lived experience, which is mental health. And in these few minutes that I have, I'll just try to capture my thoughts on the barriers which exist when it comes to accessing mental health care. And that can be summarized in, I think, 4 points. The first is the stigma. There is so much of social stigma when it comes to mental health. Anything mental health, forget about mental disorders, whether they are common disorders like anxiety and depression, or the more severe ones like schizophrenia or even bipolar for that matter. So what happens is the stigma generates a vicious cycle, like a serpent eating its own tail. So people don't speak out because of the stigma, the fear of the stigma touching every aspect of their lives, and not just but their families as well. And that stigma leads to silence, and silence leads to further stigma. So that's a cycle that goes on. And I truly, sincerely believe that we need to break that. And that's one of the reasons why I keep speaking about my own experience. The second aspect I would like to highlight is the disproportionate numbers that exist when it comes to the professionals available who impart the mental health care, and the number of people who actually need to access the health care. And here, to be honest, a lot of people don't even know what is the difference between a psychiatrist and a psychologist. And then there are psychotherapists. And unfortunately, this is one area which is also populated by a large number of quacks and people who are not so qualified to impart counseling or therapy, so as to say. And that's where people suffer. I mean, I've had my own experiences, and I'm sure anyone you talk to will have their own experiences. People often reach out to me because I provide peer support to ask me for, reliable references. But a lot of times I myself am totally at sea. I don't know who to refer them to. So this is one area which probably can be addressed with more of community mental health, maybe peer support, at least for people who are not severely at risk. And I think we could look at the framework which WHO has put out, the optimal mental health care matrix and framework. So that's something that we could look at if we're looking at solutions. Then the third thing that I would like to highlight is that mental disorders are biopsychosocial in nature. They usually occur at the intersection of bio and psycho and social factors of any person's life. So any treatment for people with mental disorders needs to cover all of this. So you might need medication, which again may work or may not work, because antidepressants did not work for me, but they do work for a lot of people. But if you go strictly by research, about 30 to 40% people with depression, I'm not talking about other disorders here, they do not benefit even from like the second or third line of antidepressants. So that's only one aspect. The other is, of course, the psyche, the makeup of a person, the mental makeup. And we need, to let us say, address the challenges there. You need good therapy. You need skilled therapists, because it's not so easy. It's not it's not a high school physics electric circuit board that you can just fiddle around and it gets okay. The brain's neural networks are much more complex, not even understood fully. So it takes a lot of time. Therapy also needs time to work. And of course, the social aspect, like if you take a woman who is experiencing domestic abuse at home, you can pump her full of antidepressants. You can give her any kind of psychotherapy, which tells you, okay, this is not the moon, this is the sun, and everything is bright and rosy and think positive. but she will not get better. So these are things that we need to remember, because we live in a social context, in a social environment, and depression or most mental disorders are biopsychosocial in nature. Now, the fourth one that I would like to highlight today is the caregiver's burden. It's just not easy taking care of someone who has a mental disorder. I'm talking about common mental disorders. Let's not even talk about the severe ones, where you have those, the dystopian, hellish establishments where people are locked up. I'm just talking about someone like me who had depression. And when I was first diagnosed, the only support I had was from my husband, who was with me standing through it all. It was very difficult to convince the rest of my family, forget about my workplace or other people. And it's only after years of patiently advocating for myself and for mental health in general that now it's much easier to explain to people what it means. But there's a lot of support which is required, and financially it's draining. Even with middle-class salaried person like me and my husband, therapy sessions are so expensive. Medication is expensive. We spent a lot of money just getting better. And of course, the effect that it has, like when I look at my children, sometimes I just don't know, what has happened to them, how this has affected them, the years when I was just lying in bed, not able to get out. And so these are four broad categories that I wanted to highlight today. I also want to say that maybe today, if you look at me standing here talking to you, you will not figure out that I'm just about 3 or 4 weeks into recovery from my latest depressive episode, which started about a little over a year back. You will also not see the anxiety that I faced. Yesterday, something just I don't know what it was that was triggering it. I was just feeling very, very anxious. And like today, even to come here, so I had to kind of calculate all my steps that, okay, I have to get up at this time. Please take these many steps to the washroom, take these many steps to the car. Will my driver be on time? So all of this, these are anyone can think about these steps when they have to go out to do something. But for someone with anxiety disorder, it means calculating everything to the last bit. And you would also not know how much of hyper focus it requires for someone with ADHD to sit still when others are speaking, wait their turn, and come out and speak here. But in case I've been able to make a little bit of dent in any stereotype that you held, the audience here, I'm really grateful for this opportunity to be able to do that. And I'm just hoping that we have more conferences like this in the future where patients' voices are heard. There is so much to talk about, but then there is only so little time. Thank you all. Thank you very much.